Hello and welcome everyone. My name is Renee Garrett and I'm your speech therapy PD podcast host for Brainstorms, Functional Neurorehab for SLPs. Before we get started, we have a few items to alert you to. Each episode is 60 minutes and will be offered for zero point 0.1 ASHA CEU. Here are the financial and non-financial disclosures. Dr. Kelli Uitenham is the owner of Serenity Speech Therapy, PLLC, the owner of Kensington Academy, LLC, and the founder of Brain Talk Foundation, an independent contractor for Great Speech Incorporated. She's a Power of Patience affiliate, Freed AI affiliate, and Cognition ambassador. Dr. Uitenham receives compensation from Speech Therapy PD for this presentation. Her non-financial disclosure is that she's a member of ASHA and NBASLA, the National Black Association for Speech Language Hearing Scientists. My financial disclosure is that I'm a paid employee of a private consulting firm in the Commonwealth of Virginia. As the host of Brainstorms, Functional Neurorehab for SLPs, and other webinars on speech therapy PD, I do receive financial compensation. I'm also an adjunct faculty instructor for both James Madison University and Old Dominion University. My non-financial disclosure is that I'm the secretary for the Communication Disorders Foundation of Virginia. Questions can be written in the Q&A or the chat box and will be answered throughout the presentation. Now, without further ado, we welcome our guest, Dr. Kelli Uitenham.
Hello, everybody. How are you?
I'm going to read through your bio.
Okay.
So, Dr. Kelli Uitenham is a nationally certified medical speech-language pathologist and a highly respected and passionate public speaker. She owns Serenity Speech Therapy, a private telepractice. Dr. Kelli is also the founder of Brain Talk Foundation, a nonprofit that raises awareness about different neurological and neurodegenerative conditions with a special focus on concussions, traumatic brain injuries, and CTE in athletes. She has over a decade of experience working with adult and geriatric populations, specializing in dementia, stroke rehabilitation, dysphagia, Parkinson's disease, fluency, voice disorders, gender-affirming voice services, and accent modification. Dr. Kelli has worked in skilled nursing, assisted living, and independent living facilities, hospital and home health settings, as well as travel speech therapy. Let's talk about that. She's licensed to practice in 9 states, providing services in each via telehealth. She's also an adjunct faculty member and has taught at Shaw University, North Carolina A&T State University, St. John's University, and has worked as a clinical instructor for Purdue University. Dr. Kelli has been invited to speak on a wide range of topics, including traumatic brain injury, concussions, CTE in athletes, long COVID brain fog, dysphagia, aphasia, providing services via telehealth, etc. In addition to her professional achievements, Dr. Kelli enjoys riding motorcycles, traveling, and spending time with her teacup Yorkie Braxton. Dr. Kelli, you know better than riding the motorcycles. What in the world? What in the world?
I know. It's my little piece of freedom. I mean, my patients tell me, like, you've got to be responsible in that thing. You've got people to take care of.
Well, and all full disclosure, of all the times that I've taken care of a patient with TBI that was a result of a motorcycle accident, and probably 99% of the time it was not their fault.
Oh, yeah.
Full disclosure.
Yes.
Yeah.
We call cars cages, and so it's like, look out for the cage. But I do my best to be as safe as possible. I do.
And then a little teacup Yorkie. So it's always fun to learn things about our guests and then to kind of see, what people are interested in beyond the scope of our SLP practice and our CSD practice.
Yes. I do have a little dog. He's 4 pounds. His name is Braxton, and he's just the sweetest. Yeah. When he gets his way.
Yeah. I mean, that's pets 101, right?
Yes.
So kind of talk us through how you sort of worked your way into being passionate about brain health or TBI, because I know for me, I started out working in inpatient rehab and I was the young, fresh, many moons ago, the young, fresh clinician who I say this and it sounds weird every time I say it 15 years later. I love a good TBI. For me, it's such a challenge as a clinician, but it also is a challenge to support the patient functionally and their caregivers as well. So, is that your experience, or was there something else that led you to move into this realm of TBI?
Well, mine was actually from the very beginning. So when I got into grad school, and I was not a speechy from undergrad, I was a journalism and mass communications major. And so after I graduated, I went to graduate school for speech therapy. And during that time, I fell in love with the brain and just everything neuro I wanted to get my hands on. So from grad school on, I knew that I wanted to work with adults. And so I was just always trying to learn as much as I could. And so the sports space, which I raise awareness about, there to this day, there isn't, a huge awareness about speech therapists and what we do when it comes to cognitive rehabilitation. So honestly, my first passion for the brain was with the military, because in grad school, that was like where you got all of your opportunities to work with TBI. And even then, it was like such a coveted spot. It was so difficult to get into the VA or to get
Mhm.
into a space where you could get access to those with TBI. My program actually had an opportunity to work with athletes. They had a clinic that was specifically for athletes to work with speech therapists. But I'm sure plenty of listeners know collegiate athletes are extremely busy. And so there were never any athletes for students to work with. And so, and when you're in grad school, it's all about those hours. And so if the clinic has no patients, no athletes for us to work with, and there are no hours there. And so I really had to divert my attention and go with where the hours were. And so there's always been this like thirst and this want for working in this space. And so when you get into like the SNF space, the skilled nursing space, definitely working with brain injury from falls, but that's where you see more of like the dementia and more neurological, neurodegenerative conditions versus straight TBI. But when I would get exposure to TBI and I would get a patient, I would feel I would feel kind of bad. I'd be like, yes, I got one. But I had to
Okay,
get
that
my
makes me.
experience this way. Yeah. It's like I got a case. Yes. And then you get to pour in all of the stuff that you've been researching and being so passionate about.
Yeah, no, I agree. I feel the same way. Like I said, early, my first job was in inpatient rehab after grad school, and I still call it my first love. I got really great exposure to working with stroke patients and spinal cord injury patients and a lot of other things. But the TBI patients, as soon as I would see those pop into our list of who was getting, yeah, who was the new admission tomorrow, is like, yes.
Yeah.
And
Yes.
I think it does take that passion to the next level for you to really be passionate about it, but also understand functionally what those patients need, because it is markedly different from, a 75-year-old with dementia who has a fall. You got your 25-year-old or your 28-year-old motor vehicle crash patient who is living this early part of a very full life, and may or may not be a spouse, and may or may not have children, may or may not be working on some sort of academic pursuits or career pursuits. And so there's a lot of different dynamics across the lifespan that really impact how we treat those patients and how we are able to show up and be present and know kind of how to articulate a treatment plan truly.
Absolutely. And tailoring it to what that patient needs. And it's funny, I
Mhm.
actually have I have a patient on caseload right now who is exactly that, mid-20s, motor vehicle accident. So they are definitely out there. So I'm glad to have the experience and the passion to help this young man, because it takes time and patience, and I'm glad that I have the passion and the patience for it. I love it.
Yeah, no, I agree, and I think it's very different from the old structured things. Well, at least things I saw in graduate school that were more of like, oh, we'll give this patient a worksheet, and let's hope that they can not only attend but know how to follow directions, be able to write. be able to do it in a timely manner, and it just that is not
Yeah.
that is just not a good treatment plan for really for anyone.
Yeah,
That's
yeah.
all.
I very much like to focus on the functional exercises. So when I'm, doing even from the initial eval, and I say this when I'm speaking to students or anyone who I just could be having a conversation with, like a young or something. But I like to ask them, like, what do you like to do, and find out about their life and things that are passionate for them, because I get to use that in therapy, because that keeps them motivated, especially when like exercises get hard or they feel discouraged. My client, who is in his 20s, who has a TBI, he loves sports. And so we will use sports. I use sports scores. We use his sports team, all kinds of things that we can use for his memory, and even with external memory aids, just really incorporating who he is as a person, what he loves to do. And that's how you get your patients to just love therapy sessions. And so his sessions are actually an hour long, and I will catch him at the end, like trying to extend the session by asking more questions. And I will say, okay, it's time for us to hang up now. And he's like, but you just bring so much goodness to my life. I don't want the session to end. So you've got to make sure that they love therapy, because I love being in therapy with my patients. I say that all the time.
Yeah, I mean the buy-in is just crucial for making sure that they want to participate, they want to be active in the treatment plan, and having that patient shared decision making model is really important as well.
Oh, yeah.
So we talked in your bio about the Brain Talk Foundation, but what was your inspiration behind that?
Well, I've always had that passion for the brain. And I was invited to speak at SCSA, which is the South Carolina State Association. And they asked me to do two featured talks. One was on concussion and TBI in athletes. The other was in thinking outside your speech path, and just
Mhm.
talking about how SLPs can really leverage their already expertise into additional funds. Who doesn't want that, especially in this economy? And
Right.
so I did the presentation on concussion, and the response was so overwhelming. I had a very long line, and it's funny, you're, as someone who goes to these conferences, you're the person who's standing in line. You're like, I just want to ask this person like this one question, or see about a collaboration. Like, you just never know. But I was normally the one who's like, I just want a quick moment of your time. But the line was very long for me, and so because I've been in that position, I really wanted to give everybody their time. And so in speaking with these speech therapists, they were scared, and they were saying to me, like, I think my husband might be showing signs. I think my kids may be showing signs. Like, what do I do? What's the protocol? Who can I talk to? And they were just asking all of these questions. And I was thinking, they just asked me to come and present. I wasn't ready to have these additional conversations, but that really made me think, if our colleagues who have access to this information and who have been, to school for this information, if they don't know this information, what are the chances that my neighbor knows, that the people that I go to church with know, or that, just somebody else who's in line with me at the grocery store, what are the chances that they know this information? And as I started informally polling people, it was almost zero. So many people aren't aware of this. And I was an athlete. I love sports. And I know the goodness that comes with sports. And so I know that parents have a really good reason and a really good intention for putting their kids into sports. But I also think that it is fair for parents to really know what the risk is for any sport, um, so that they know to ask the right questions, so they know what symptoms that they should be looking out for. Because I have spoken with parents who unfortunately have lost their children on the field. I've spoken with parents whose children will never be the same, who have lost significant IQ points. I spoke with one father, and his son lost, I believe it was 39 points on his IQ. And so to know that these parents are out here and that these are not isolated incidents, I was very much motivated to make sure that the awareness was spread. And so from that, I spoke to a friend of mine and I was like, I've got this idea. I really want to raise awareness, but I'm not quite sure how to navigate. And she was like, if you don't have a nonprofit, you got to get a nonprofit. So I was like, okay, well, I guess I'll get a nonprofit then. And so it really just grew from there. And it all came from that wonderful invitation to be a featured speaker at SCSA.
Oh, that's so cool.
Yeah.
Yeah, and I think that's a lot of the time how the networking piece works. And again, that could be a whole different conversation, but really, truly, the networking piece is so important, especially in the brain injury community, because I know early in my career, I kind of felt isolated because everybody was doing dysphagia and swallowing disorders, and a lot of people were moving towards just motor, speech, or voice disorders. And I kind of felt like sometimes I was on the lonely island because I really love the cognitive communication rehab and working with the brain injured populations across the lifespan, because I've worked with everything from, student athletes in high school to geriatric, like, we mentioned before, patients who've had falls or other things that, were prohibitive for their cognition and their communication. And I just think it's really important to acknowledge that and see that we have this space too where we can connect and share research and work together across these state lines and across even international lines, because that's where we're moving towards in the future, which is very cool.
Yeah.
Yeah. So what do you see what do you see the foundation doing as far as now it's started? How long has it been around? How long have you been working with the having your own
11
nonprofit?
months.
11 okay, almost a year, yay for you.
Almost a
That's
year.
well, I'm sure you've learned a lot in a year, I'm sure. So that's a great place to sort of look at what you've been able to accomplish and reevaluate where what your goals are, or expand on the goals that you had that maybe you met. So can you
Yes.
speak to that?
Yes. So, one, I love the idea of collaboration, across state lines, worldwide. I try to attend like global, TBI conferences when I can, any TBI conference really. But I see more collaboration. So, I love connecting with SLPs, other medical professionals, because that's a huge thing too. Like I said before, others don't know exactly what we do in this space. And so I want to collaborate more. And I say all the time, like, I can't do this by myself. Like, I can't raise awareness to everybody who needs to hear this by myself. So I want other SLPs to hear these words, share these words, go out into their communities and do it as well. So, collaborating with other SLPs, other medical professionals. And then I have a community event called Brain Talk Day. And I really want to bring that into the schools because I am a millennial and I remember DARE,
Yeah.
the drug
Yeah.
program. And so I don't remember everything that was in the workbooks. I remember the resource officer coming in and talking to us about certain things and peer pressure and say no to drugs and it's okay. And these are things that, they're going to say to you to try to convince you. And that really worked for me. I was I was the L7 who was like, no peer pressure. Like that worked for me. And so if I can provide that offering to kids at that age, I would love that for them to, just if it's the colors, if it's the logo, if it's that Dr. Kelli lady, like whatever it is that they can grasp onto and say, like, hey, like I'm having a really hard time with the lights in school. And I did take a really elbow to the head during that basketball game. And if they can put two and two together and think maybe I need to get some help and maybe I need to talk to somebody and maybe a speech therapist, I would be so happy. That's really what I want. I really want the awareness. I've even, for my first Brain Talk Day, I was able to partner with Northeastern University, the Charlotte campus here. And we had our first Brain Talk Day November 9th last year. And I created these magnets with the help of a wonderful graphic design artist. And it is a split of, or a split screen, if you will, of what to do if you are going to see a medical professional after you suspect a concussion, and what to do if you are not going to, like what signs to look for. And then the big thing that I was talking about was the golden ticket. And the golden ticket is the speech therapy order. And so I was telling athletes and telling parents and the other community members who attended, this is what you need to ask the doctor to write. And so I gave them the order, ST to eval and treat as indicated. And I said, this is something for you to get or ask your pediatrician or physician to write for you when you go in for your annual physical, or when you have to go in, because athletes have to do a physical every year. And so ask them
Mm-hmm.
for the golden ticket right then, because if you get injured, now you don't have to wait and go back to the doctor and explain things. And even if those secondary injury, those symptoms are showing up days or weeks or months later, now they already have the golden ticket and they can start rehabbing their brain right away instead of having to start from square one.
Yeah, no, and I think that's great, because what we see a lot, even when it's student athletes, but also with our post concussion syndrome patients or TBI patients that are a result of a motor vehicle crash, is that they either get a very specified treatment order of 1 to 2 visits, or their insurance is dictating 1 to 2 visits, and it's just not enough, because people are looking at the physical components. And even if the patients are exhibiting things like poor balance, or decreased stamina and physical activity, what they're not really able to articulate, or what the physician isn't always seeing, is the cognitive load exacerbating the physical deficits, or vice versa. The physical load is decreasing the patient's ability to participate in cognitive activities that should not be really changing their day to day, but it does, and we know that. There's a lot of research to support that, and I think it's really important. I think that's a great way to start, is the golden ticket. That's fantastic,
Yeah.
because
And also,
it's a
okay.
preemptive thing, right?
Yeah, and also making sure that the doctors know. I was at a convention in the brain injury convention in South Carolina again. I'm in North Carolina, so I get to pop down there, get the best of both worlds. But I heard a physician speaking, and at the end of his talk, I asked him, "How often are you referring to speech therapists?" And he was like, "I don't." And so I explained who I was and about Brain Talk, and I said, "Well, how are your colleagues doing with referring?" And he was like, "I know they're not referring." And he said, "Until you stood up and spoke," he said, "I would have never thought to have reached out to a speech therapist at all." And so every time that I give a little tidbit and get feedback, I think, okay, there is so much work to be done, because the medical community also needs this information. And as a medical SLP, PT and OT, they have an idea because we're on the same team, but it's still not the same as the pediatrician knows that they need a speech therapist. The internist needs to know this. Like, just all medical professionals need to be aware, and everybody needs to know the signs. So I want to raise awareness to significant others as well, and teachers, and if we're talking about sports, the coaches and referees, athletic trainers. Everybody should be aware, because everybody should know what to look for signs and symptoms, because the brain is, a brain injury is an invisible injury. And so with cast, someone breaks their arm or their leg, if someone's in a wheelchair or has a cane, those are visual cues to be more patient with somebody. Can I open this door for you? Can I carry your books for you? And when someone has an invisible injury, then quote unquote, look fine. So what's wrong with you? What's your problem? And to raise the awareness for people who could experience these injuries, it's important that they can advocate for themselves and say what's going on. And something else to expand upon for Brain Talk, my goal is to also raise awareness around other brain conditions. So raising awareness about dementia, Parkinson's, stroke, aphasia, PCS, and that is kind of like the whole totality, which is why it's called Brain Talk. We're talking about the brain, the total brain, and also wanting to expand into the space of mental health, because something that is a part of brain injury is so many things in your life can shift and change. Aside from the actual chemical makeup of your brain and how it functions, dealing with those things can feel very isolating, and that can lead to depression. And so mental health is a huge piece that I want to incorporate. And it actually was a huge piece that was incorporated during Brain Talk Day. And I'm blessed enough that it has been requested to be an annual event. So we'll be working on it again for 2025.
Oh, that's exciting. Yeah. And I think I'm with you on the mental health piece and to kind of expand on that, the role of SLPs as counselors in not necessarily counseling for mental health as far as a therapy, not overstepping our mental health professionals, but in order to refer ask for referrals to mental health professionals, we need to be aware that we do have a role in counseling our patients specifically for education on the diagnosis, the prognosis, what to expect, exactly what you talked about, the propensity for people to have these mental health disorders that are not widely communicated in our community education. Most of the time, when we have a patient with a stroke or a TBI, they don't have a clue that there's a really high probability that they're going to have some mental health concerns that are a direct relation of the chemical response in the brain to the injury that happened. I would say in the 15 years I've been practicing, I don't think when I've ever said that to a patient or a caregiver, I don't recall anyone ever saying, "Oh, yes, we knew that already. Someone told me that on day one or day five or day 10, or now we're day 35 on rehab or 6 months post our injury." I don't remember anyone ever saying to me that, "Oh, yes, we knew that. We were expecting that." I don't remember that ever being a discussion. So I think that is a really great community education piece for us all to not only be mindful of, but seek continuing education competence in so that we can provide that piece because it is part of our treatment plan. We can provide this education and this support for our clients, patients, their caregivers, and then be able to go back to the physician and say, this person is experiencing XYZ as a result of their injury. They may need a referral for a mental health professional.
Yes. And part of my informal polling that I mentioned earlier, I asked the same question. I'm writing a book, wrote a book, waiting for it to come out. But because I did so many interviews with athletes and family members, I started a podcast because I'm like, people should be able to get this information. These are great stories. And when people can hear, like, oh, like, I like this boxer, or I like this football player, and they can hear these stories, and it's like, wow, it's not just something that people are talking about for a headline. We hear about these athletes who get injured, we hear about other people who may get injured, and then a lot of times that human instinct, it's like, it's not going to happen to me. But I would like for people to be able to hear these interviews. But one of the things that I ask the people that I interview is, were you educated on it? When you did get concussed, what education was provided to you? And I don't want to say 100%, but just to be on the safe side, 99.9.5% of the people that I ask say, no, I did not get any education. And I think that, spouses, family members, everybody needs to be made aware of this, because it's going to take a cohesive unit to help the person who's injured.
Yeah, and when we talk about brain health, I think that's part of it specifically for athletes is that they're not being made aware. And I'll backtrack a little bit. My son was a high school swimmer, and people are, I've had a couple of people that were like, "Oh, that's great, good for you." But thinking about at that time when he was a high school swimmer, they were actually doing precog rehab for them. They were doing this baseline cognitive testing, they were doing questionnaires, things like that, so that if something happened, and they did this for a lot of athletes where I live, if something happened, they had an injury on the field, in the pool, whatever, that's where their concussion based questions come from, is this precog rehab program that they were doing. And so I had a couple of people recently who were like, oh, he's a swimmer. How could he possibly get hurt? And I'm like, have you ever watched the Olympics or any swimming event, indoor or outdoor? There's a pool with a concrete wall. And when they flip turn, I've seen kids smack right into the wall. They could be experienced or not, but it's the same thing of, watching these professional NFL athletes who've taken some pretty incredible hits this year, tackles this year with, August Tua Tagovailoa. I can't ever say his last name. I apologize. Tua from
I think it's
Tua.
Tua Tagovailoa, I think.
Thank you. Yes. And then also the young man from the Jaguars. Oh my goodness, I know his name because someone who came to an event with me is one of his cousins. But they both took some pretty incredible hits and had concussions, and it's been very well documented. But you have to
Josh
wonder.
Allen.
Yep, that too. Gosh, this guy's name is on the tip of my tongue and I can't get to it. But it just speaks to the fact that we wonder if these athletes are being provided with a basis for why they do the precog testing prior to the season starting. What is their baseline? Are they being provided with their baseline test? Basketball, same thing, or the baseball, same thing, right? They could be hit with a a ball, a glove, who knows at this point,
Catchers
right?
have the
And
highest risk.
yeah, I mean, my husband is a huge Premier League soccer fan, and it's the same thing. You watch these Premier Soccer League games in Europe where they're playing at an extremely high level and they get hit in the head with body parts and balls and whatever. And you have to wonder, are they aware of the risk, but also what their baseline testing looks like? Because it's very important for them to be mindful of that so that they know if they do sustain this hit, what when they're being tested on the sidelines, but also maybe next day, right? Because we see a lot with our concussion patients and our TBI patients where TBI, yeah, of course, if they get in a motor vehicle crash and they're unconscious at the scene, they're going to see things right away, or maybe they're not aware at all. But concussion's a little different because sometimes our patients don't see those deficits immediately. They see those symptoms that you mentioned before and those cognitive memory problems, attention problems, light and noise sensitivity. We see that a little bit, not later, but in the few days surrounding the event. And I think that's a really important piece to point out, is because I think, again, we have this role that we're not really being included in unless we're the big mouthpiece. Again, that's sort of, I think, how almost everything is with SLP and communication science disorders. We're having to be this big loud voice, and not all the time do people want to hear it.
And I've learned like I got to make a space because I kept saying to myself, like, someone's going to have to do this. Someone's going to have to raise awareness. Someone. I'm like, look in the
Yeah.
mirror, like, someone is you. So, from what to answer your question, it wasn't really a question, but I have not spoken to a professional athlete who has said that they were given the rationale for the baseline testing, given extensive education on baseline testing. So that's something that I would really love to do, is to make get it into legislation to where athletes and parents and people who are going to do anything high risk to where they could have a concussion or a head injury, with learning how to drive, that would be fantastic if they would include that. But of the people that I've spoken to, they have not been given a rationale. And for the baseline testing, I have learned that they intentionally flub those baseline tests, and then they teach the incoming athletes how to flub the tests. And that way, when they, get their bell rung, eye roll, then they know that when they go back and they have to take that test again, if the baseline test doesn't look that bad, then whatever they take at the time post injury, it'll look like they're fine.
Mm-hmm.
Yeah.
Yeah, and again, going back to your training early on when you were, I think you said graduate school, military population does the same exact thing. I'm a spouse of a retired military member, and I've had several times where we had friends who were like, heavily involved in environments that were, it was combat. Let's just be honest. It was combat, and maybe where they were stationed or supporting were not what, the high tech or the high end, but they were supporting pretty close by. So um, they don't want to admit sometimes to the things that they've experienced because they know someone else had it worse. And I think athletes do the same thing. They know someone else had it worse, so they're devaluing their experience because they know someone else had it worse than they did, and they don't want to be taken out of that environment. They don't want to potentially lose job value or contract value, or in the military, advancement potential. So yeah, we see that across multiple environments for patients who have had TBI and concussions, and we need to change the mindset. And that's the bottom line. We need to really change the mindset of not only the community education, but the value that we are able to provide from an much earlier standpoint than just rehab after this injury has occurred.
Yeah. And I think that, with changing the mindset, really, which is why, we need as many SLPs and as many people to raise awareness as we can, because we're essentially looking to change the culture around these spaces. Because my entire family is military, and they very much have told me, after they come back from a deployment, they do have to go and speak to someone about their mental health, and the answers are pretty much the same. Like I said, what I had to say to get out of there. And
Yep.
I think that it's very similar in the sports realm. And I think that if we had more safe spaces and where these individuals had a level of trust with the higher ups, whether it be a commanding officer or a coach, if it wasn't well, if there's something wrong, then you're out of here kind of culture. I think if there was take the time that you need and really rehab your brain because we need you, your spot's going to be here when you get back. I think that would give people in all kinds of spaces more time to relax and put their mind at ease and do the rehab that they need. Hopping to the sports again, but I can say the other sports that I've spoken about, or the other athletes outside of football, like boxing and baseball, they really take the rest break seriously. So in boxing, they have something called a 30-60-90. And if you are, concussed, or if you have a technical knockout, TKO, then you are put on a mandatory hold, and they will not release you for anything until that time is up. And it varies on whether you lost consciousness or not. But then we look at the NFL and we see Josh Allen was absolutely unconscious on that field, and timing it from the time that he lost consciousness, went into the blue tent, and got back on the field was just below 6 minutes. So how do you
Mm-hmm.
go from that to another sport and you can't even touch a mat or train or spar or anything for 90 days in some cases? So a lot to be done, and really, really changing mindset, framework, and really the culture.
Mm-hmm. Trevor Lawrence, Jaguars. That was the
Right.
other. Yeah,
Got it.
that was the one. And I watched it, and they both
Is
to
this the one
a
where the helmet came off?
maybe, but they both had the posturing, the decorticate posturing that was very troubling for me because I teach a TBI course, and so I was teaching it in the fall and actually used it in the coursework because for the graduate students, it's very helpful for them to see a concrete example because even if they're in their clinical practicum, they're getting all this knowledge, right? We're feeding them full of this information and this knowledge, but they don't always see it. A lot of things that we learned early on in our career, we didn't see it right away, or we saw it once and then we might not see it again for 4 or 5 years. And so for them, it was very helpful to have this video that they could go back and look at and see what we were talking about, as troubling as it is. But they need to be aware because, again, even if you're not solely working in a space where you're working with athletes necessarily, a lot of our SLPs work in big cities, right? Where these sports teams are housed, whether it's NFL, NBA, Major League Baseball, or a sports collegiate team, a sports high school team, you're probably going to see an athlete at some point, unless well, and even when I worked at the little small rural community hospital, we still saw people that were here visiting family that emergently got hurt, who may need to go transfer to a larger level 1 or 2 trauma hospital. So you're going to see it at some point. And I think it's helpful for people to be more equipped to deal with that and advocate, because advocacy is such an important part too of what we do early on, because maybe they are stuck in this little small hospital that may not have all the resources that they need, and now we need to be these advocates to get patients to the next level of care that may be more comprehensive for what their needs are. And that kind of leads me to that common misconception about brain injury. You mentioned it being sort of that silent injury, that silent diagnosis, because people look fine. But what are you all doing as a foundation for community outreach and kind of to advocate? I know you mentioned the Brain Health Day through the university, but just as your nonprofit is still growing, what are you all planning to do, or what have you already done for community?
So the big thing really is the awareness piece because so many people are unaware. So that's the huge thing that we're working on, is just raising that awareness. And then also allowing community members to ask questions. I love to, point people in the direction of functional and necessary resources. So some people don't know that I'm going to mess up the word now. Neurooptometrists exist. So people who, are, you know, their vision. So, you think about the occipital lobe and how that could take a blow in a motor vehicle accident, a fall, sports, anything. And people don't know that, their vision is something that they should be keeping an eye out for. Of course, we have so many different areas of the brain that control so much. But when I give my talks and I'm doing the awareness piece, I like to kind of go around the brain and help people understand, because a lot of times they're hitting the temporal lobe, they're hitting the back of their head, they're hitting the front part, that frontal lobe. So giving them education on what those things control and what signs and symptoms they may be experiencing if they have that injury. And then we're, having an outlet, a resource for them to know what kind of speech therapist they should be looking for and when it's time to get a speech therapist. The challenging part with that is I can't see everybody. And so referring them to speech therapists who have experience, telling them what letters to look for behind their name, if it's a CBIS professional, because of course CBIS is not only speech therapists, but there are other medical professionals who can have it too. But also when you go to a speech therapist, these are some things to ask. Have
Mm-hmm.
you have experience with working with someone with a traumatic brain injury? You can ask them, how many patients or how much experience, how confident are they? Because that's something else that I have found, is that people who do get injured, they may go to a medical professional and they don't have the expertise that are needed. And so they're like, well, we just wasted our time, in
Mm-hmm.
their eyes, because it's like, if you could have referred us to someone who can specialize in this and really tailor what, the patient needs, it would have saved us a whole bunch more time. And I always like to say to students and younger SLPs, we as SLPs are being inserted into someone else's crisis, because if they didn't have an issue, they wouldn't need us. And so knowing, setting pride aside or what have you, don't be afraid to refer out and say,
Mm-hmm.
I may not have the expertise or may not be able to gain access, because take CEU courses, reading, going over articles, looking up, different treatment ideas, talking to, again, collaborating with other professionals. All of those things are necessary to provide the best kind of care. And sometimes that could be referring out. So letting people who come to the community events, letting them know that, also letting them know, kind of pulling back the curtain, that medical doctors are not trained in concussion formally, to where all doctors that you go to are going to have some form of training when it comes to concussion and some sort of specialization expertise. And I learned that from the doctor that I spoke with in South Carolina. And he himself said, I want people to understand that it's not this put all of your eggs in one basket. I've gotten in with the doctor, I've gotten in with the neurologist. And so now all of my problems are going to be over because he's going to see me, he's going to lay hands on me. And he said, if he is seeing a patient who has a concussion, he said he's writing a prescription for PT, going to put him on physical therapy. And he said, but if that, patient comes back and is saying, I'm having a hard time with the lights, I'm, still dizzy, I can't focus on my tasks. He said, after that, I'm putting them on pills. And that was
Mm-hmm.
prior to him speaking to me and knowing that speech therapy was an option. So, really, just being as intricate as possible and arming and preparing people who come to events with the information so that they can kind of have a guide and a roadmap of what to ask for. Because that's something else that I've learned about in doing my podcast, is people feel like they have no guidance. They're like, the doctor told us that he was concussed or that I was concussed, and I got a pat on my back and told to check in if something drastic changes. And that is what happens across the spectrum. We're in a silent epidemic. We're up 1 million concussions. I'm sure you're aware of that, nationwide. And that is from either missing the concussion completely or not accounting for those secondary injuries. And then you've got patients who are still dealing with it every single day, but they don't know to advocate for themselves. They don't know that they can ask for resources or accommodations. They don't know about speech therapy. I actually connected with a former executive of a company, and she is 3 years post, had no idea about speech therapy. And she's like, she was applying for disability, and she was like, I had no idea that speech therapy could help me with these daily things. And she was just kind of like, she said, I'm just making it. I'm just surviving this as best I can. And I'm like, for 3 years, and nobody told her that we exist. And so now she is seeing a speech therapist, and things have completely turned around for her. And I'm so happy for her.
Yeah, no, and I think that's great because a lot of people also, when it comes to neurologists, they don't realize, just to kind of give an example of like a person who is either early diagnosed or not diagnosed with Parkinson's or another essential tremor, like a non essential tremor, they don't realize they need to be seeing a neurologist who's a movement disorder specialist. Our TBI and concussion patients don't realize that this different variations within the neurology field for dealing with cognition versus like a neuropsychologist, for example, or someone who specializes in the diagnosis of dementia. There's these little micro branches of neurology that a lot of our patients, and I think a lot of SLPs don't even really know unless they have worked in a space where they've been exposed to it, that there are neurologists that specifically deal with these types of cases, and it's not every neurologist. Even my hairdresser has MS. She deals with a very specific neurologist who treats her for her MS, her multiple sclerosis. She doesn't just go to a neurologist who may be looking at brain rehab, for example. She's dealing with someone who has this subspecialty in her disorder. And I think a lot of people don't realize that. They don't know. We're not really educated on that. Our communities aren't educated. Again, I feel like we have a lot of work to do, and um,
That's
until
what we're
we,
doing at Brain Talk.
yeah, and I think until a lot of other SLPs get on board and really make a lot of noise in this arena, A lot of people have made a lot of noise in dysphagia, for example, and they're really doing a lot of great work and research, which is great. It's bringing a lot of community education about, a lot of international resources about. They have these great conferences, but for us working in this space of progressive neurological disorders, or just a neurological disorder like an acquired brain injury or traumatic brain injury, we don't there's not a lot of people that are making a ton of noise. There's very specific people that most of us would say we know who they are. They're doing research, like Dr. McKay Solberg, Dr. Lynn Terkstra, people like that who have been around for a while in the university and academia space, who've done a great amount of research and provided so much for us as SLPs to be able to utilize, but it's not being matriculated down to our communities. And I think that's where the problem really, really lies, is making sure that it's at all levels, not just at this level where we're SLPs with master's degrees or PhDs or SLPDs or what's it, CSDs, EDDs, all the Ds.
Yeah, very true. Very true. I actually have a goal because I think it's going to be easier to educate the SLPs that are already in place in schools. I know that they're not medical, and I know that, they may be overworked, not may, they overworked, overwhelmed with the caseload. But I really consider them like sleepers, because if we can activate them to give them knowledge on what signs to look for, and this is what you can do, at least at a very entry level, these are some exercises, these are some things to tell the parents to look for. I think that would be phenomenal. I've been doing my best to kind of get my foot in the door to expand it for more speech therapists. And what I started doing is going to football games. It was football season, so I want to get into other sports as well, but going and being on the sideline. Right now, I'm really assessing how their concussion protocols are going. Not the greatest from what I've seen. So there are ways to improve the systems that they have in place. But again, I can't do it by myself. I need more SLPs who are going to be willing to go on the sidelines, stay after school. I mean, they even have physical therapists who are assigned to go to different sporting events. And it's like, well, speech therapists need to be a part of that too, or at least be a part of the designing of the concussion protocol on how they can get the cognitive rehabilitative piece incorporated. Because when you hear about, oh, concussion protocol, you think physical. So a lot of times people are like, well, how do you look? How's your balance? Can you run? How are these other things? But they don't think about return to classroom, return to learn, return to work. And those are things that need to be educated to the public.
Mhm. Yeah, and I will say my friend Gerald Jackson, many of you know, because he was the co-chair of the ASH convention, but a wonderful human. He has actually said
Wonderful.
that, yeah, the school-based SLPs are not medical, because, and I didn't think of it because there has been this divide for so long, because I've always worked in healthcare, that the school-based SLPs are the ones who, when these kids have a TBI, right, or they get concussed, they're going back to school. The school-based SLP is the one who typically is treating them, because it's free and mandated under the education system, whereas their medical insurance may not cover them going to an outpatient clinic for additional services. And so I think that's a spot on point, is that the school-based SLPs should be more versed in dealing with kids, because kids too, they get their passengers in motor vehicle crashes. They are,
Program.
yeah, they're victims, unfortunately, of abuse, neglect, domestic violence as well. And so they're experiencing concussions and TBI as a result of that. And where are they getting their services? A lot of times it's in the school. So I think that's a brilliant place to be in, and space to connect with.
Yes. I've spoken to pediatric SLPs because, again, I want them to have this information to work with the kiddos who are experiencing the things that you just mentioned. And when I speak to them, they're like, like don't remember much about it, don't have the expertise, wouldn't feel comfortable with it. And so now it's like, how do I bridge this gap to
Mm-hmm.
provide them with the education? So right now I'm working on a course that I can offer to pediatric SLPs to at least give them like some basics, some signs, how and who they can refer kiddos to, where else they can go to get additional education, CEUs, because if they can get the education to do just baseline, some exercises, that sort of a thing, I think that could really, really help push rehab along and for students and other youth to get back to that return to learn, return to play, whatever it may be.
Yeah, and when I was at ASHA, I did an invited talk on post concussion syndrome, NCTE, and that was one of the things that I talked about was even though I don't work with the high school age kids who are high school athletes, I've had a high school athlete, and I have consulted on that before from colleagues of mine who had been in school based SLP and gone to pediatric outpatient, but the students were like 16, 17, which was totally in my wheelhouse, and there are some really good, like Concussion Legacy Foundation is a really good, it's a good organization, and they don't pay me or anything like that. They do a really good job of providing not only YouTube videos that show like actual clients or actual kids, adults who have had these concussions that have resulted in post concussion syndrome that have been impactful for their life, and they talk about that very thing about their return to academics and how it's such a challenge for them to, 2 weeks post, they're getting completely cleared by their PCP to go back to a full day of school, but they can't. And finding an advocate within the school, whether that's a guidance counselor, an administrator, a teacher, whatever that looks like. And I think that's a really, really important piece to point out because, again, not a lot of people realize that that's something you need to be advocating for. But if you are a school based SLP, you can be helping to advocate for those half day or those in home services for those kids or teens that can't. They just
Yeah.
can't. I mean, it's not their fault. They shouldn't be shamed for it, and it does lead to things like anxiety, depression, both PTSD, same thing. And
Yeah.
as we're kind of wrapping up, I'm sorry, Kathy, I know you've asked this question twice and I apologize, but she asked if you could repeat what the details are of the golden ticket.
Oh, yes, absolutely. So the golden ticket is basically where I provide the community members who came to Brain Talk Day, I provide them with what a speech order should say, and that is ST to evaluate and treat as indicated. And so I'll write it out. I wrote it out for them. Oh, I should have brought the magnet. I wrote it out the way that a medical professional would write it out, and then I wrote it out longhand. So I did the ST2, and then I had EVAL for eval / treat TX as indicated. And that way, if they needed to just give the doctor or nurse practitioner the actual verbiage or words, they could do that as well. But I will say what you were talking about with youth and really just the perception. So I was at a football game on the sidelines, and there were two players who had on sunglasses. They weren't suited up. And of course, I'm looking at them and I'm like, they've been concussed and these lights are really bright. It was a night game. And someone that I was in earshot with said, these guys think they're so cool. They think they're hot stuff. They're in high school and, they're on the sidelines, got these sunglasses on. And I'm like, I'm guessing this is concussion related, but let's just see. Sure enough, I get a chance to meet the young men and I ask them what's going on. And they were like, yeah, the lights are just really painful right now, but we still came to support our team. And then I got to meet the teammate that concussed each of these young men. And when I spoke to this young man, he was a really big high schooler. He was really big. And I said, you were working a play, you were practicing, and then your teammates got concussed. And this young man said, I don't believe in concussion. And I said, well, how long have you been playing? He said he'd been playing since he was 6. So I can only imagine.
Oh boy.
Yeah. A lot of work to be done. I just say that to myself all the time. There's so much work to be done.
Yeah, I was just going to say job security. I only laugh because I have this weird sense of humor when it comes to this sort of thing. A
Well, I
lot
mean,
of
when
that,
you're in it all the time, you have to a little bit, I think.
yeah, it's a coping mechanism, right? I mean, for real, for me, it really is because I was a caregiver first, and it takes me back every time to thinking about the lack of community education, but also the lack of patient and caregiver education at the time when my dad had a stroke when I was 25, long before I was an SLP. So yeah, I think we still it's crazy because that was such a long such a long time ago cuz yeah. But at the
Couple,
same time we just we have a long ways to go, and I'm grateful for people like you who are doing the nonprofit and doing the extra work on the side to help make sure that our patients and their caregivers in our communities get that education and that foundation they need, whether they have an injury or they haven't had an injury, but we want them to still be mindful so that they can be advocates if they know someone who winds up in that situation. So
I say
I
that
just,
all the time. Share it with
yeah,
someone who needs to hear it. Everybody needs this information because if you know someone, love someone, or in relationship with someone, they could have a brain injury. They could
hmm,
acquire one. They could end up with something, neurodegenerative. Know the signs, know what to look for because you can save precious time. But I'm sure, as you know, if even with, dementia, children of their parents don't want to face that reality. And so it's like, oh, they go along with the masking that the parents say because they'd rather do that than realize that, possibly their hero has an issue or could be slipping away. And I always say, like, buy yourself some time, like,
hmm,
face it, do the best that you can, but get the diagnosis, get the, evaluation, know the status, and then go from there.
yeah, 100% agree. Dr. Kelly, thank you so much for joining us. I love talking to you, and I think this was just a great episode. And again, I appreciate you and all the work that you're doing for our communities and our patients and our caregivers.
Thank you so much, Renee. Thank you for having me. This was absolutely wonderful.
Fantastic. Again, thank you for being here, Dr. Kelly, and we look forward to seeing you again.
Thank you. Have a wonderful evening.